So many Americans start the new year off with a popular detox resolution, and that is committing to dry January. I bet a lot of you are doing it at home right now. It's where you cut out alcohol for the entire month. Well, now you have this new trend emerging. High January. Cannabis companies are using the leverage to entice more people to switch over by promoting its benefits like zero hangovers, 0 calories. But is it really the healthier option? Joining me now is Forbes Public Health Senior Contributor, Dr. Omar Awan. Doctor, it's always good to have you. I mean, you know, so many people do this. My husband's currently doing this. And after the holiday season, all the celebrations you have, it feels good to kind of cut back for a moment. But is replacing it with high January, I mean, does that cancel out the health benefits of staying sober? It seems counterproductive to me, but yeah, what do I know?
Yeah, absolutely, Markie. Good morning. Well, this transformation from dry January to high January is a little silly to me because the whole purpose and inspiration behind dry January is to improve our overall health, to detox, as you said, and to decrease the amount of harmful substances that we put into our body. And both alcohol and marijuana are drugs. They're both harmful to our bodies. And the message really should be to decrease the amount of harmful substances that we put into our body, despite the fact that marijuana is a little less toxic than alcohol, but we shouldn't be replacing one with the other.
Yeah, and talk to us more about how cannabis affects things like sleep, mood, anxiety, motivation, compared to alcohol for people who are wanting to make one choice or the other.
Well, what I'll say is that both can alter your mood, they can alter your judgment, they can alter your balance, coordination. One thing about alcohol is that it can cause cancer. You know, alcohol is linked with a number of different cancers of the liver, the colon, the breast. For marijuana, that relationship is not entirely clear, but both can also increase your risk for heart disease, heart attack, stroke. That's something that we often don't talk about enough. But one thing about marijuana is that it can exacerbate mental health conditions, things like depression, anxiety, making them worse. And also even certain psychotic conditions like schizophrenia. And that's become a major problem across EDs all across America, especially with young people. People are coming in with schizophrenia from marijuana. That's the condition where you start to have hallucinations, where you hear and see things that aren't actually present. And that's a serious issue. So very scary.
I was also thinking, you know, I think a lot of people who are weighing these two options at home, there's probably also a lot of people who are conflicted as to why they think they need to take any sort of drug or substance to soften their realities, right? I mean, are there any other alternatives that you would recommend for stress relief or, you know, social anxiety, that kind of thing, instead of these two substances?
Well, one is exercise. You know, exercise can boost our strength, it can boost our immune system, and just social connections. We often don't talk about just meeting people, talking to people, and this era of social isolation, social media, really important to just get out there and talk to people, make meaningful relationships. One thing I do want to talk about with marijuana, though, is that it does have some medical applications, and I think that's why there's some confusion amongst the public about this. Marijuana can be used to treat chronic pain, particularly in patients that have damaged nerves. It can be used to treat nausea and vomiting, particularly in cancer patients. It can be used to treat certain seizure disorders, whereas alcohol has no health benefits. It cannot be used for any medical issues. So that's something to keep in mind.
It has been a game changer for a lot of people and patients. But I guess no one size fits all, right? Talk to your health provider about what might be best for you. Dr. Omar Awan, thank you so much, as always, for your time and expertise. Have a great Tuesday.
My pleasure. Thanks, Markie.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.